Hello, Thunder Bay. I want to first thank you for your commitment to following public health guidelines to keep our COVID numbers as low as possible. Our rate of double vaccinations is good, and boosters are now available for the over 50 population, and vaccines have been approved for the 5 to 11 age group. With that being said, we have seen a rise in cases recently, and we know with certainty that the numbers can rise very quickly, as we saw last year. We must not get complacent, especially as we enter the winter season. The cold weather will bring about more indoor gatherings, and the holiday season is just around the corner. That means more travelers to our city, more travelers returning to our city, and larger indoor gatherings. I appreciate that many are fatigued by this ongoing pandemic. However, we must remain vigilant and remember the positive impact our adherence to public health guidelines has on those around us. Please remember our most vulnerable, our seniors, those living with disease, and those that are immunocompromised. And we cannot forget the effort and sacrifice put forward by all frontline workers over the last 20 months. They are also counting on your continued vigilance. We have seen the emergence of a new variant this past week. It reinforces the need for us all to stay the course for as long as necessary until we emerge on the other side of this pandemic. Your individual decisions and actions affect everyone around you, and by extension, all of us. That is the insidious nature of this virus. We have no choice but to act in concert, to be mindful of our broader community. Our businesses are just now getting back on their feet. We do not want to contribute to a situation that might force the province to once again bring in more onerous restrictions on their ability to operate, to make a living, and to provide the goods and services we rely on. And we certainly do not want to see our hospitals overwhelmed with COVID cases. It represents a dramatic impact on the ability of our hospitals to provide healthcare services to patients waiting for their care that is not COVID related. And it can have very negative outcomes for those patients and their families. I want to close by once again saying thank you for your efforts to this point and call on you once again to please stay the course. Thank you, Thunder Bay.